I'm a chemotherapy nurse in the outpatient department. We give chemotherapy intravenous, tablets, subcut injections, but I think the role is bigger than that. I think we're there to make sure that people are safe with their treatment. It's not just about sticking a needle in them and then pumping them full of drugs and sending them home. Quite a lot of the work is making sure they know enough about their treatment to be able to sort of take care of themselves.
I get to see cancer and chemo patients in settings other than cancer wards, and then I get to pass on and dispense relevant advice that might either facilitate quicker discharge or ease their symptoms quicker.
It's a much bigger directorate than you think it is. You sort of think it's this little ward upstairs, and then you go downstairs and it's huge, and there's so many different specialists who come in, and it's really interesting to see.
We deliver the chemotherapy, look at the protocols, check the bloods, make sure the patients are seen in clinic, make sure that they're fit for the treatments, they know what's going on, so we involve them at every stage.
Quite like it because you have to sort of manage your own time, and you have your own list of patients that you call up, you meet them, assess them, are they good for treatment?
We have around 20 to 25 chairs that we provide treatment for, and we've also got a bed that can be used, which is also covered by acute oncology. If they need to bring anyone in unwell, that bed's available for them to triage. There's usually 5 different areas that treat on a day-to-day basis, and I would say on a normal day in between 8 to 12 patients are treated by each team, and that's not including the oral clinic, which covers, I would say, anywhere up to 20 patients, and that's on a Monday, Wednesday and Fridays.
You get to know these patients a little bit better, and it becomes less about the treatment and the side effects because they're up and running with it and they know what they're doing, and it becomes more about what's happening in your life that you're really enjoying at the moment. It's quite humbling, really, quite humbling.
I absolutely love it. I feel humbled, and I feel it's just an amazing place to be. I think without the team we wouldn't be, well, in my opinion, as good as we are. But the feedback that we get from the patients, you know, they give us such positive feedback all the time, and it's just amazing. And just to be part of that cancer journey for them, and to make it, you know, as bearable as possible. And you know, it's I don't think there's another place within nursing that's as good.
The team I work with, we're also a bit like a family, so we all talk to each other, we all work well together.
I find it's a very good group of nurses. Quite a mixed bunch. There were some people who come from the ward and have always worked in oncology, and then we've got some other nurses who've come from working in prisons, people who've come from community nursing, urology, so there's quite a good mix really.
Make no bones about it, it's the best job in the world, but it is, you have to be very committed, and you have to not only look after patients but look after all the staff.
We have had patients come back and say they've got the all clear, they've had a scan, they've got the all clear, and that's amazing. That's what we're here to do, and I just think seeing stuff like that makes it absolutely worth it.
I think we've been very lucky at impressing oncology because we've got some visionary leaders, and we're trying to constantly improve our services given that there's more and more cancer patients every year.
I feel like the 3 managers we've got at the moment know what it's like to work all hours and all shifts, and they've worked on the wards, and they've done a lot of nursing in their time, so I feel as though they sort of know what they're talking about. So they're approachable, but if they say this needs to be done, you do it. They're the kind of managers that you want to work your socks off for, I guess.
All the managers are out of the office, they're not just sat in there. They're all going through it all with us. They're not sort of to the peripheral of it at all. They're really, really helpful. They're really good and really supportive.
We're one of the major cancer centres for the North West. We treat patients all up to the South Lakes. We cover people over towards Merseyside and also across to East Lancs as well. So we provide facilities that other smaller hospitals won't have.
Preston has developed into a major cancer centre. So if you come and work here, you get obviously the experience of working in an oncology centre, where you've got all the nurse specialists, we have oncology pharmacists, oncology dietitians. So you've got all those people feeding into cancer care who've got a special interest, and there's nothing more exciting, if I can use that word, about working within a multidisciplinary team where everybody's there because they like cancer.
I always wanted to come back to Royal Preston and give back to where I did all my training. I really enjoyed my training, so I felt it was a place to be and to help other students that come through hopefully get a good experience like mine.
I think there's a lot of opportunity in Preston. I mean, this hospital is a major area for the whole of the North West in terms of oncology. I mean, we get people as far as Cumbria down here, and it's growing all the time. It's not getting any smaller, that's for sure. And that means that we've got lots of opportunities for people employment-wise to go into different sort of areas as well. You couldn't ask for more, really. There's so much you can do. There's so much you can learn from here.
For experience of different treatments, trials, and maybe unusual tumour groups that you might not see anywhere else, it's very good for that.
I love the care that we give here, and that's why I wouldn't want to move anywhere else.
There are just so many avenues you can take within oncology.
When this opportunity came up to come and work in oncology and in chemotherapy, I jumped at the opportunity, and I've never looked back. I think it's amazing.
The smile you get, immediate smile you get from somebody, especially when you think that it's involving pain, it doesn't compute, does it? You're doing something painful to the patient, but they smile and appreciate it. That's one of the most wonderful things in the world.